everyone, welcome to The Dish. I'm your host, Anna Christina. Thank you so much for tuning in. Hey guys, we're kicking things off with Awareness with Anna. September and October are the awareness months for breast and ovarian cancer, so today our focus is on that. And here to help educate us and bring some awareness is Dr. John Hardaway. He's from Doctors. Thank you so much for being here.
Thank you so much for having me.
So I hear that you're from Texas.
That's correct.
Ooh, buddy, and you want to stick them up real quick, give a
horns.
shout out. Hey, I know that that is not good to do here in Georgia, but I'm a fellow Texan, so I gotta get it in when we can, right?
I appreciate it.
Well, let's talk about this. This is actually a very serious topic, and I feel like we are typically, as people, the greatest advocate for ourselves, and I think that it's important to educate ourselves on particular topics like this so that we give ourselves a better chance at surviving it and fighting it. Breast and ovarian cancer. I know a lot of people know warning signs on breast cancer, maybe not so much ovarian cancer. Let's talk about that. Break it down for us.
Sure. So as we talked about, breast and ovarian cancer Awareness Month is in September and October. And it's important to be mindful of that as a patient because you need to be engaged in self-breast exams. You need to be talking with your provider if you're finding any symptoms that would be concerning for ovarian cancer. And we can talk about a few of those as well.
Well, that's what I want to kind of focus on because people sometimes don't know what to look for.
Right.
Some of the warning signs of ovarian cancer seem to be pretty normal, things that we would typically live with if we're maybe eating foods that cause gas or bloating, and those actually, bloating could be one of the warning signs. So let's talk about the warning signs for both.
Okay, yeah. So really, when we talk about ovarian cancer, we're thinking about masses that are in the pelvis, something that's going to cause a mass effect on, say, your bladder or your intestines. And as a consequence, if you have any symptoms such as urinary urgency or change in your bowel habits or some increase in abdominal girth, those are all signs and symptoms that you're going to want to, if they last for, say, more than 2 weeks or so, talk to your primary care provider or your gynecologic provider for further assessment. Well,
and that's why they call it the silent killer, because they are those signs that maybe you would just write off.
Right.
And I also, let's talk about breast cancer before we talk about writing things off, because I feel like that's important to talk about as well. But what would be some of the signs when you're doing self-examinations? What should we look for?
Right. So I think that when you're in your 20s and you're starting your monthly self-breast exams, that's an important part to get familiar about how to do a self-breast examination. From there, in your 25, age or so, what you're going to do is you're going to start having a every 3 year or so exam by your provider. And then getting to your 40s, you're going to start with your annual mammograms. But things to look out for in your self-breast exam is that you want to look for any new lumps that might be painless or painful. You might have some nipple retraction, which is also known as inversion, as well as any increases in lymph nodes, either in your armpits or by your collarbone.
Okay. And we mentioned write things off. I know a lot of people are quick to not, or for fear of what might be happening, they don't take the initiative to go get checked. They write things off. They don't want to face those negative, or what they feel like might be negative information in return. Why is it important for people to be proactive?
Well, the story that I'll share with you is I had a patient a few years ago who came to me, had this progressive feeling of fullness in her abdomen. Really, her abdomen had gotten progressively larger, and it had paralyzed her, really. The stress had gotten to a point to ultimately she had to come because she really wasn't having bowel function and so forth. But I just want to say, if you're having those types of symptoms, please don't let that perpetuate. Please just seek help. The earlier that we can identify and diagnose these issues, the much greater outcomes are, and the much broader our ability is to cure these situations.
Right. So go get checked, be proactive, take the initiative to be your own advocate, because I feel like we as people know our bodies better than anybody else. And so the doctors are there, they have resources, you can go to doctors. I'm sure there's plenty of doctors that you can set up some appointments with to get pelvic exams, because you should be doing that anyways.
Right, and you mentioned that briefly. So one of the important differences between ovarian cancer and breast cancer is that we do have a readily available screening modality, such as mammography for breast cancer, but unfortunately for ovarian cancer, we really have to rely on the patient to come forth with those symptoms and really help us further the diagnostic process.
Right, so important. And so one of the other resources that you guys have is something called Ask Sara. Why don't you tell everybody about that?
Okay, great. Yeah, so Doctors Hospital is part of a larger cancer network known as Sara Cannon, and one of the tremendous resources that we have available is called Ask Sara. We'll provide the number, but eventually, basically what that helps us do is that it offers an opportunity for patients who have any questions about cancer, if it's a diagnosis or any questions about symptoms they're having, really to speak to a nurse navigator and help them answering the questions they have.
And obviously, I know these months are important, September and October, as Breast and Ovarian Cancer Awareness Month, but I feel like it's important to state that it's always important to be aware and throughout the entire year to be your own advocate. So Dr. John Hardaway, thank you so much for being here. We really appreciate the information and educating us on that and what to look for. Thank you so much for all you guys do at Doctors.
I appreciate you having me.
All right, guys, don't go anywhere. When we come back, we're going to get a little lesson in law. We'll be right back.